My name is Dr. Jennifer Hayes, and I work in the emergency department at Chicago General Hospital. I have been doing this job for 9 years now, and I thought I had seen everything. Drug overdoses, car accidents, heart attacks, you name it. But nothing prepared me for what happened to Lisa Morgan on the night of March 14th. Lisa came into our emergency room around 11 p.m. on a Tuesday. She was 28 years old, blonde hair, bright blue eyes, and looked like she could be a model. She came in complaining of severe chest pain and difficulty breathing. Her boyfriend Mike brought her in, and he was clearly worried. "Doctor, please help her," Mike said, as we got Lisa onto a bed. She was fine an hour ago, and then suddenly she could not breathe. I did a quick examination. Lisa was conscious, her vitals were stable, but she was clearly in distress. "Lisa, can you tell me what you were doing before the pain started?" "We were just having dinner at home," Lisa said between breaths. "Nothing unusual." Then suddenly my chest started hurting really bad. I ordered the standard tests: blood work, chest x-ray, EKG, everything we normally do for chest pain cases. Lisa seemed like a healthy young woman, so I was not expecting to find anything serious. Maybe anxiety, maybe heartburn, but nothing life-threatening. "Mike, does Lisa have any medical history I should know about?" I asked. "No, she is the healthiest person I know," Mike replied. "She goes to the gym 5 times a week, eats clean, does not smoke or drink." This is so weird. While we waited for the test results, I admitted Lisa for overnight observation. Her chest pain had decreased with medication, but I wanted to monitor her to be safe. Mike stayed with her until visiting hours ended at midnight. Then he went home promising to come back first thing in the morning. "I will be fine, Mike," Lisa said as he kissed her goodbye. "Go get some rest. I will see you tomorrow." I checked on Lisa one more time around 12:30 a.m. She was resting comfortably, watching TV in her room. Her test results had come back mostly normal, just slightly elevated stress hormones, which was not surprising given her symptoms. "Try to get some sleep, Lisa," I told her. "We will do a few more tests in the morning and hopefully get you out of here soon." "Thanks, Dr. Hayes," Lisa said with a smile. She looked tired but otherwise fine. I went to catch up on paperwork and see other patients. The night shift was busy as always. Around 3 a.m., I was dealing with a car accident victim when one of our nurses, Karen, came running to find me. "Dr. Hayes, you need to come to room 307 right now," Karen said, and I could hear panic in her voice. Something is wrong with Lisa Morgan. I rushed to room 307, expecting to find Lisa having another episode of chest pain or maybe a heart attack. What I found instead made absolutely no sense. The woman in the bed looked nothing like the 28-year-old Lisa Morgan I had admitted just a few hours earlier. This woman had deep wrinkles around her eyes and mouth, gray streaks in her blonde hair, sagging skin on her neck and hands, and age spots on her face. She looked like she was in her late 40s or early 50s. "What the hell?" I said out loud, then caught myself. "I'm sorry, but who are you? Where is Lisa Morgan?" The woman looked at me with Lisa's blue eyes and said in Lisa's voice, "Dr. Hayes, it is me. I am Lisa. I do not know what is happening to me." I stood there frozen, trying to process what I was seeing. The voice was Lisa's, the eyes were Lisa's, but the face, the skin, everything else looked decades older. "Karen, check her wristband," I said, thinking maybe there had been some mix-up with patients. Karen checked. "It says Lisa Morgan, date of birth April 3, 1995. This is the right patient, Dr. Hayes." I looked at the woman more carefully. Despite the aged appearance, I could see Lisa's features underneath. The shape of her nose, the set of her eyes, the way she moved her hands. It was definitely Lisa. But she had somehow aged 20 years in less than 3 hours. "Lisa, when did you notice these changes?" I asked, trying to stay professional despite my shock. "I woke up about 20 minutes ago and went to the bathroom," Lisa said, and I could hear terror in her voice. When I looked in the mirror, I saw this. "Dr. Hayes, what is happening to me? Why do I look like my mother?" I had no answer. In 9 years of emergency medicine, I had never seen or even heard of anything like this. People do not age 20 years overnight. It is medically impossible. "Karen, I need you to call Dr. Peterson from dermatology and Dr. Chen from endocrinology, I said. Get them here immediately. And bring me Lisa's chart from tonight. While Karen made the calls, I did another examination of Lisa. Her vitals were still stable. Blood pressure normal, heart rate normal, oxygen levels good. Physically, aside from her appearance, she seemed fine. But her skin, hair, and overall appearance had drastically changed. Dr. Hayes, am I dying? Lisa asked, tears running down her now wrinkled face. Is this some kind of disease? I do not know yet, Lisa, I answered honestly. But we are going to figure this out. Have you taken any medications tonight? Anything unusual? No, nothing, Lisa said. Just the pain medication you gave me earlier. I looked at her chart. Everything was normal. The medication I had given her was standard and could not possibly cause this kind of reaction. Dr. Hayes, Karen said, coming back into the room. Dr. Peterson and Dr. Chen are on their way. And I have something else you need to see. Karen showed me her phone. She had pulled up the security camera footage from the hallway outside Lisa's room. I was curious about what happened, so I checked the cameras. Dr. Hayes, you need to watch this. Karen and I went to the security office to watch the full footage on the bigger monitors. The security guard on duty, Tom, pulled up the cameras for room 307 and the hallway outside. What time do you want to start from? Tom asked. Start from midnight when visiting hours ended, I said. We watched the footage at normal speed at first. At 12:07 a.m., we could see Mike leaving Lisa's room, kissing her goodbye at the door. Lisa waved to him, and he walked down the hallway toward the elevators. Nothing unusual. At 12:15 a.m., I appeared on camera, doing my final check on Lisa. I stayed in her room for about 3 minutes, then left. The hallway was quiet after that. Fast forward to around 2:30 a.m., I told Tom. He sped up the footage. For the next 2 hours, nothing happened. No one entered or left Lisa's room. The hallway was empty except for occasional nurses passing by on their rounds. Wait, stop there, Karen said, pointing at the screen. Tom paused the footage at 2:47 a.m. In the frame, we could see something strange. The door to room 307 opened slightly, and someone peeked out into the hallway. But we could not see who it was because they stayed inside the room. That is weird, Tom said. Why would she open the door and not come out? Keep playing, I said. The door closed again. For the next 10 minutes, nothing happened. Then at 2:58 a.m., we heard the call button from room 307 being pressed. That was when Karen had gone to check on Lisa and found her looking 20 years older. Tom, can you play back what happened inside the room? I asked. Do we have cameras in the patient rooms? No, we only have cameras in the hallways for privacy reasons, Tom explained. We cannot see what happens inside the rooms unless the door is open. This was frustrating. The security footage showed that no one had entered or left Lisa's room between midnight and 3 a.m. So whatever happened to her happened while she was completely alone in that room. Dr. Hayes, look at this, Karen said, pointing at another monitor. This is the camera at the nurse's station. You can see into room 307 when the door is open. Tom pulled up that footage. At 12:15 a.m., when I was in Lisa's room doing my check, the door was open and we could see inside. The footage clearly showed young Lisa lying in bed, looking exactly as she had when she was admitted. Can you find any other times when the door was open? I asked. Tom scrolled through the footage. Here at 1:30 a.m., Nurse Kelly did her rounds and the door was open for about 30 seconds. We watched that footage. Lisa was still young, sleeping peacefully in her bed. And here at 2:15 a.m., Tom continued. Kelly checked again. Same thing. Young Lisa, sleeping normally. So between 2:15 a.m. and 2:58 a.m., something happened to her, I said. But no one entered the room during that time. Karen looked at me with confusion. Dr. Hayes, how is this possible? How can someone age 20 years in 40 minutes without any external cause? I had no answer. By this time, Dr. Peterson and Dr. Chen had arrived and were examining Lisa. I went back to room 307 to hear their assessment. Dr. Peterson, our dermatologist, looked completely baffled. Dr. Hayes, this is the strangest case I have ever seen. Her skin shows all the signs of natural aging, loss of collagen, decreased elasticity, age spots, wrinkles. But this did not happen gradually over decades. This happened in less than an hour. Dr. Chen, our endocrinologist, was equally confused. I have taken blood samples to test her hormone levels, but preliminary results show nothing unusual. No thyroid problems, no growth hormone issues, nothing that would explain rapid aging. Lisa was crying quietly in her bed. Please, somebody tell me what is happening. How do I fix this? Can I go back to normal? None of us had an answer for her. Dr. Peterson tried to be reassuring. Lisa, we are going to run every test we can think of. There has to be a medical explanation for this. At 6 a.m., Mike arrived at the hospital as he had promised. When he walked into Lisa's room and saw her, his reaction was shock and disbelief. What the hell happened? Mike said, looking between Lisa and me. Where is Lisa? Who is this woman? Mike, it is me, Lisa said. I know I look different, but it is me. Mike stepped closer and looked at her carefully. Lisa, how is this possible? What did they do to you here? We did nothing to her, Mr. Johnson, I said firmly. We have been monitoring Lisa all night, and this happened while she was alone in her room. We are trying to figure out what caused it. Mike pulled out his phone and showed me a selfie he had taken with Lisa at dinner the night before, just a few hours ago. The photo showed young, beautiful Lisa smiling at the camera. The contrast with the woman in the bed was shocking. Mike, I am scared, Lisa said. What if I keep aging? What if I look like I am 80 by tomorrow? This was a legitimate concern. If Lisa had aged 20 years in a few hours, what would stop her from aging more? We are going to keep you under close observation, I assured her. If any more changes occur, we will know immediately. At that moment, my phone buzzed with a text message from Corinne. Dr. Hayes, you need to come back to the security office. Tom found something important on the footage. I excused myself and went back to meet Karen and Tom. When I got there, Tom had the footage paused on a particular frame. Dr. Hayes, I went back and looked at the footage more carefully, Tom said. Look at this. At 2:47 a.m., when the door to room 307 opened slightly, I enhanced the image. He zoomed in on the doorway. I could see a shadow of someone standing there, but the face was not visible. Now look at this, Tom said, pulling up another angle from a different camera. This camera is down the hall, but it catches a reflection in the glass door of the supply closet. I looked at the enhanced image. In the reflection, I could just barely make out a figure standing in the doorway of room 307. The figure looked like an older woman, not young Lisa. Are you saying Lisa already looked older at 2:47 a.m.? I asked. It looks that way, Tom said. Which means the aging happened between 2:15 a.m. when she looked normal, and 2:47 a.m. when she peeked out the door. This narrowed our timeline down to about 30 minutes. But it still did not explain how or why this happened. Over the next 12 hours, we ran every medical test imaginable on Lisa. Blood work, hormone panels, genetic testing, brain scans, everything. A team of specialists came to examine her, including a geneticist, a neurologist, and even a psychologist to rule out any psychological factors. All the tests came back showing the same thing. Lisa was physically healthy, but her body showed all the markers of being 20 years older than her actual age. Her telomeres, the protective caps on chromosomes that shorten as we age, were significantly shorter than they should be for a 28-year-old. Her collagen levels, skin elasticity, and bone density all match someone in their late 40s. It is like her body actually aged. Dr. Chen explained to me and the other doctors. This is not makeup or a hoax. At the cellular level, Lisa Morgan is now biologically 20 years older than she was yesterday. Mike refused to leave Lisa's side. Despite the shocking change in her appearance, he held her hand and tried to comfort her. We will figure this out, Lisa. I do not care what you look like. I love you. But Lisa was devastated. Mike, I am 28 years old and I look 50. How can you even look at me? Because you are still you, Mike insisted. The way you look does not change who you are inside. I appreciated Mike's loyalty, but I could see the strain this was putting on both of them. Lisa kept looking at herself in the mirror, crying at what she saw. Around 3 p.m., I got a call from hospital administration. They wanted to know what was going on with the patient who had mysteriously aged overnight. Word had spread throughout the hospital, and people were starting to ask questions. Dr. Hayes, we need to handle this carefully. The hospital administrator, Mrs. Roberts, said. If this gets out to the media, it could cause panic. We need to have a solid medical explanation before we make any statements. Mrs. Roberts, we do not have a solid medical explanation yet. I admitted. We are still running tests. Then keep running tests until you find one, she said firmly. And keep this quiet. The last thing we need is reporters swarming the hospital asking about a woman who aged overnight. As I hung up the phone, Karen came to find me again. Dr. Hayes, I think you should talk to Lisa more about what she remembers from last night. Maybe there is something she is not telling us. I went back to room 307 and asked Mike to give us a few minutes alone. Once he left, I sat down next to Lisa's bed. Lisa, I need you to think very carefully about last night, I said. Is there anything at all that you remember between 2:15 a.m. and 3 a.m.? Anything unusual? Lisa thought for a moment. I remember waking up around 2:30 or so. I felt strange, like my skin was tingling all over. At first I thought it was just a reaction to the medication. Did you look in the mirror at that time? I asked. No, not right away, Lisa said. I tried to go back to sleep, but the tingling got worse. It felt like my whole body was buzzing. Then I got up to go to the bathroom, and that is when I saw myself in the mirror. What exactly did you see? Lisa closed her eyes, remembering. At first I thought there was something wrong with my eyes, like they were playing tricks on me. But then I realized my face looked different. It was still me, but older. I touched my face and felt the wrinkles. That is when I started screaming and hit the call button. Did you see or hear anything else unusual? Any other people, any strange sounds? No, nothing, Lisa said. Then she paused. Wait, there was something. Right before I woke up, I was having a really weird dream. What kind of dream? I dreamed that I was old, like 70 or 80, Lisa explained. I was in a nursing home and I was thinking about all the things I never got to do in my life. It was so vivid, so real. And then I woke up and I looked 20 years older. This was interesting. Lisa, have you been stressed about aging? Worried about getting older? Lisa hesitated before answering. Actually, yes. My mother turned 50 last month, and seeing her at the party, seeing how much older she looked, it really got to me. I kept thinking about how I only have 20 years before I look like that. Did you talk to Mike about these fears? A little bit, Lisa said, but mostly I kept it to myself. I know it sounds silly, being 28 and worried about aging, but I could not stop thinking about it. I made notes on everything Lisa told me. Then I asked the difficult question. Lisa, is there any possibility that you did something to yourself? Maybe took some medication or supplement that could have caused this? Lisa looked offended. What? No. 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 Dr. Hayes, why would I do this to myself? I did not take anything except what you gave me. I had to ask, I said. We are trying to rule out every possibility. After leaving Lisa's room, I met with the team of doctors who had been working on her case. Dr. Chun, Dr. Peterson, the geneticist Dr. Kim, and neurologist Dr. Adams all gathered in the conference room. All right, let us go through this logically, I said. We have a healthy 28-year-old woman who aged 20 years in about 30 minutes. No one entered her room. She took no unusual medications. Her tests show actual biological aging at the cellular level. What are we missing? Dr. Kim spoke up. I have been researching cases of accelerated aging. There are genetic conditions like progeria that cause rapid aging, but those develop over years, not hours. And Lisa has no history of these conditions. Dr. Adams added, I reviewed her brain scans. There is no evidence of stroke, tumor, or any neurological event that could explain this. What about psychological factors? Dr. Peterson asked. Could extreme stress cause physical aging this rapidly? Not to this degree, Dr. Chen said. Stress can accelerate aging over time, but not like this. We were going in circles. Every medical explanation we could think of did not fit the facts. Then Dr. Kim said something that changed the direction of our investigation. Wait, Dr. Hayes, you said Lisa mentioned having a vivid dream about being old right before she woke up and discovered the changes, correct? Yes, she said she dreamed she was 70 or 80 years old in a nursing home. Dr. Kim looked thoughtful. What if the aging is not the result of a physical process, but a psychological one? What if Lisa's intense fear of aging somehow manifested physically? That is not possible, Dr. Peterson said. The mind cannot change DNA and cellular structure just through thought or fear. Are we sure about that? Dr. Kim asked. There have been documented cases of psychosomatic symptoms that produce real physical changes. Stigmata, phantom pregnancies, stress-induced hair loss. What if this is an extreme version of that? I considered this theory. It sounded far-fetched, but so did everything else about this case. Dr. Kim's theory about psychological factors led us to bring in Dr. Sandra Martinez, one of the best psychiatrists in the city. She spent 2 hours talking privately with Lisa while we monitored from outside the room. When Dr. Martinez finally came out, she had a serious expression on her face. Dr. Hayes, I believe I know what happened to Lisa, but you are not going to like it, Dr. Martinez said. We all gathered in the conference room again, as Dr. Martinez explained what she had discovered. Lisa has been dealing with severe anxiety about aging for the past year, Dr. Martinez began. It started when her father died suddenly of a heart attack at age 52. Lisa became obsessed with the idea that life is short, and that she is wasting her youth. But how does anxiety cause physical aging overnight? I asked. It does not, at least not directly, Dr. Martinez said. But here is where it gets complicated. During my session with Lisa, she admitted something she had not told anyone, not even her boyfriend Mike. Dr. Martinez paused before continuing. 6 months ago, Lisa started taking a supplement she bought online that was supposed to slow down aging. The supplement was called Ageless Pro, and it claimed to use cutting-edge science to reverse cellular aging. Did she still have the bottle? Dr. Chun asked urgently. No, she threw it away 3 weeks ago when she ran out, Dr. Martinez said. But I researched the company online, and it turns out Ageless Pro was shut down by the FDA 2 months ago for making false claims and selling unregulated products. This was a major development. What was in the supplement? I asked. That is the problem, Dr. Martinez said. The company never disclosed all their ingredients. The FDA seized their products but has not yet released a full analysis. However, there were customer complaints about side effects including skin problems, hormonal changes, and in one case, rapid aging. Wait, someone else experienced rapid aging from this supplement? Dr. Peterson asked. According to the FDA report, a 50-year-old woman in California aged significantly after taking the supplement, Dr. Martinez explained. But the case was not well documented because the woman refused medical treatment. I felt a mix of relief and anger. Relief that we finally had a potential explanation, and anger that Lisa had been taking unregulated supplements without telling anyone. Why did not Lisa tell us about the supplements earlier? I asked. Because she was embarrassed and scared, Dr. Martinez said. She knew she should not have been taking unregulated products, and she was afraid of getting in trouble or being judged. She also did not think it was relevant because she stopped taking them 3 weeks ago. But the effects could still be in her system, Dr. Chen said. If the supplement contained hormones or other compounds that affect aging, they could have built up over 6 months and then caused a sudden reaction. Dr. Kim added, and if Lisa was under stress and had a vivid dream about aging, that psychological trigger combined with the chemicals in her system could have activated a cascade of physical changes. It was not a perfect explanation, but it was the best we had. We immediately contacted the FDA to get more information about Ageless Pro and the compounds it contained. While we waited for information from the FDA, I had to tell Lisa and Mike what we had discovered. When I entered room 307, I could see the fear in both their eyes. Do you know what happened to me? Lisa asked. Lisa, we believe your aging was caused by the supplement you were taking, Ageless Pro, I explained. The FDA shut down the company for selling dangerous products, And there have been other cases of people experiencing aging effects from their supplements. Mike looked shocked. You were taking supplements? Lisa, why did not you tell me? I was embarrassed, Lisa admitted. I knew it was stupid, but I was so scared of getting older. The website made it sound so safe and scientific. Lisa, those supplements were not tested or approved, I said. They could contain anything. The FDA is analyzing them now to figure out exactly what was in them. Can you reverse what happened to me? Lisa asked desperately. Can you make me young again? This was the question I had been dreading. We do not know yet. First, we need to understand exactly what the supplement did to your body, and then we can explore treatment options. The FDA results came back 2 days later. The Ageless Pro supplements contained a dangerous mix of synthetic hormones, experimental peptides, and chemical compounds that were designed to affect cellular aging. The problem was that the compounds had never been properly tested, and they could cause unpredictable reactions in the human body. According to the FDA report, the supplements worked by accelerating the body's natural aging and renewal processes. In theory, they were supposed to speed up cell turnover to make skin and tissues younger. But in practice, they could malfunction and cause the opposite effect: rapid aging. So the supplement was supposed to make me younger, but instead, it made me older, Lisa asked when I explained the findings. Not exactly, I said. The supplement was manipulating your body's aging process. For 6 months, it might have been working as intended, but something triggered it to reverse course. Maybe the stress from your chest pain, maybe the vivid dream, maybe just a chemical imbalance. We may never know the exact trigger. Can it be fixed? Mike asked. We are consulting with specialists who deal with hormone treatments and cellular aging, I explained. There might be ways to partially reverse the effects, but I need to be honest with you. We may not be able to return Lisa to exactly how she looked before. Lisa started crying again. Mike held her hand tightly. We will get through this, he told her. I do not care if you look 28 or 48. You are still the woman I love. Over the next few weeks, Lisa underwent intensive hormone therapy and treatments designed to help her body stabilize. The doctors managed to reverse some of the aging effects, but not all of them. When Lisa was finally discharged from the hospital, she looked like she was in her mid to late 30s rather than her late 40s. 3 months after the incident, Lisa came back to the hospital for a follow-up appointment. I almost did not recognize her at first. She had cut her hair short, changed her style, and had a confidence about her that I had not seen before. Lisa, you look great, I said honestly. How have you been feeling? Physically, I am doing much better, Lisa said. The hormone treatments have helped stabilize things. I still look older than I am, but I have made peace with it. And mentally, how are you handling everything? Lisa smiled, and I could see that despite everything she had been through, there was something lighter about her now. Dr. Hayes, I know this is going to sound strange, but in some ways, what happened to me was the best thing that could have happened. I was surprised by this response. Really? How so? Before all this, I was terrified of aging, Lisa explained. I spent so much time and energy trying to stay young, trying to prevent the inevitable. I was so focused on how I looked that I was not really living my life, she continued. But now, after experiencing what it is like to suddenly age 20 years, I realize that aging is not the scary thing. The scary thing is wasting your life being afraid of aging. That is a very mature perspective, I said. I had to mature fast, Lisa said with a laugh. Literally. But seriously, Dr. Hayes, I look in the mirror now, and I see someone who has been through something difficult and survived. I see someone who is stronger than she thought she was. How is Mike handling everything? I asked. He has been amazing, Lisa said. At first I thought he was just being supportive because he felt obligated. But he really meant it when he said my appearance does not matter to him. We actually got engaged last month. This was wonderful news. Congratulations, Lisa. I am so happy for you both. Thank you, Lisa said. And thank you for everything you and the other doctors did for me. I know you all worked really hard to try to fix what happened. As Lisa prepared to leave, she turned back to me with one more thought. Dr. Hayes, I hope other people can learn from my mistake. Those supplements, those pills and products that promise to make you younger or more beautiful, they are not worth it. Real beauty and real youth come from living your life fully, not from trying to stop time. After Lisa left, I sat in my office thinking about her case. The security cameras had not lied. They had shown exactly what happened. No one entered Lisa's room. No one did anything to her. She had done it to herself by taking unregulated supplements in a desperate attempt to stay young. The hospital administration had managed to keep the story out of the media, which was probably for the best. But internally, we used Lisa's case as a teaching example for medical students about the dangers of unregulated supplements and the psychological factors that can affect physical health. Dr. Martinez wrote a paper about the case, changing Lisa's name for privacy. The paper discussed how society's fear of aging, combined with unregulated beauty products, could lead to serious medical consequences. 6 months later, I received a wedding invitation from Lisa and Mike. The photo on the invitation showed them both smiling at the camera. Lisa looked older than her actual age, but she looked happy and confident. I attended their wedding and it was beautiful. During her speech, Lisa talked about how the past year had taught her what really matters in life, not how you look, but how you love, how you treat others, and how you choose to spend your time. I spent my 20s afraid of getting older, Lisa told the wedding guests. Now I am technically in my 20s, but I look like I am in my late 30s, and you know what? It is okay, because I learned that aging is not the enemy. Fear is the enemy. Wasting your life worrying about things you cannot control is the enemy. The story of Lisa Morgan became one of those cases I will never forget. Not because of the medical mystery, although that was certainly interesting, but because of what it taught me about the human desire to control the uncontrollable. Lisa aged 20 years in one night because she had been trying so hard to prevent aging that she ended up causing it. The security cameras did not lie. They showed exactly what happened. But the truth was not in the footage. The truth was in the choices Lisa had made, the fears she had carried, and the lessons she ultimately learned. Sometimes the scariest thing about aging is not the aging itself, but the desperate measures we take to avoid it. And sometimes the greatest growth comes not from staying young, but from accepting that time moves forward for all of us, and that is okay. Lisa learned to embrace the age she looked, and in doing so, she found a kind of peace and confidence that her younger self had never possessed. She aged 20 years overnight, but she also grew in ways that had nothing to do with appearance. And that, I realized, is what real maturity looks like. Not the wrinkles on your face, but the wisdom in your heart.